नमस्कार. तुमकां सगळ्यांक नव्या वर्साची उनुनीत परवी परत एकदा आमी मेळटात लायफ्स ऑन विथ मणिपाल हॉस्पिटल्स ह्या कार्यावळींत. अजून पर्यंत आमी कार्डिओलॉजी केली, गॅस्ट्रोएंट्रोलॉजी केली, ऑर्थोपेडिक्स केली, न्यूरो सर्जरी केली, पूण हाज्या भायर आज आमी अशा एका दोतोराक मेळटले आनी अशा एका विशयाचेर तांचे कडेन भासाभास करतले जाच्या बद्दल आमकां खूब खबर आसा आनी कांय खबरूय ना अशें म्हळें जाता. आनी तें म्हणजे आज आमी रक्ता विशयी उलयतले. आमचे कडेन आयल्यात हिमेटो ऑन्कोलॉजिस्ट डॉक्टर महादेव स्वामी. वेलकम डॉक्टर इन दीस प्रोग्राम लायफ्स ऑन विथ मणिपाल हॉस्पिटल्स.
Namaskar.
Now actually when somebody sees a blood, then half of the people they tend to faint. Half of them get panicky, whether it is a small abrasion here or whether it is a massive bleeding in some accidents. So blood that way, the color of the blood and the blood has come out is a big fear psychosis. Now you have been dealing with blood all throughout your career in medicine. Can you tell us, in fetal life, when a child forms in the mother's uterus, embryo forms, what is the time when the blood also forms?
From 3 weeks to 6 weeks, where the first embryo forms implanted, and like the first recognizable embryo forms. Around 3 to 6 weeks is the duration where it starts producing in the liver.
Oh.
A structure like a primitive form of a liver, where it starts producing some sort of components of the blood. And also there is a yolk sac actually. Yolk sac forms the in the embryo there are different parts. Yolk sac is a one part where from there the blood cells starts like giving some products to everywhere in the embryo, and then it starts up in the liver, and then it starts up in the spleen, and then it starts up in the bone marrow.
Oh. So
in the adult life we see the production happens from the bone marrow, but in the embryo it is the yolk sac which first contributes for the hematopoiesis around 2 weeks to 3 weeks stage of the embryo, and then the liver from 6 weeks like stage, and then the spleen, and then the bone marrow. Once the baby reaches, once the embryo reaches the stage of a 9 month, then the bone marrow picks up.
So when the child is born, then the blood is formed in the bone marrow. So so bones is an important thing. Now what is formed has to be destroyed. Correct. It is nature's law. Where does the blood get destroyed?
Recycling and purifying.
Where does blood get destroyed?
The beautiful organ in the body God has given is the spleen. The spleen is a we can say it as a wonderful organ in your body. It has done it does its duty so sincerely. It cleans, it senses the blood cells which are circulating in your body. It senses the size, it senses the age of the cell, and accordingly it clears it. It has a property of eating up the dead cells, old torn cells who has done the duty too much, they are tired. It recognizes that this fellow has done too much duty, they take up the cells and it clears off. And whatever the damaged product of the blood cells, that will be again given back to liver and the bone marrow for reutilization.
I see. So like recycling phenomenon is there.
Yeah. When we example we can compare with the mobile. When the mobile has been used and we give it for the exchange, they take out the old parts and they recycle it. Like that. Like any engine or old used one which we recycle, the products which can be recycled and reused. That function is done by the spleen.
Now in normal course, everyone, all of us, when you speak of blood, two things come to everybody's mind. One is blood sugar and another is blood cholesterol. So everyone relates blood only to these two things. Now actually I would like you to tell us what this blood contains. It looks red, we don't see anything with the naked eye, but then what does it contain?
Blood contains mainly blood cells and the solution which is holding it, the suspension solution in that plasma we say. Blood contains the blood cells and the plasma, and there are proteins which are suspended in the plasma for the function required of transporting, carrying the vitamins, carrying the minerals, and clotting property. Though broadly we can divide into blood cells and the remaining solution. The remaining solution is the plasma, it contains proteins. In the blood cells, red blood cells, white blood cells and platelets. Red blood cells are RBCs, which routinely blood means red, it is a color which it is carrying, but there are different components within it. These cells are these cells are obtained from the primitive dividing cells, hematopoietic stem cells, where they divide in the bone marrow and they come to the outside in the blood. These stem cells which are there in the bone marrow, they come from the embryo.
Oh.
The embryo, which was a zygote which divides and forms multiple cells. The one of the cells will be assigned for the hematopoietic pathway. It comes from the yolk sac. So it sits in the bone marrow and then it divides. It divides and produces multiple cells. Yeah, the precursors going into committed cells, committed going into progenitor cells, progenitor going into dividing cells. The mature cells. The mature cells which we see in the blood.
Oh,
so red blood cell, white blood cells and platelets. In the white blood cells, in turn there are different types. The cells which is carrying some contents within them called as a granulocytes. So, white blood cells are basically soldiers in our body. They are for our defense, to fight the infection, to attack on the bacteria, to attack on a virus, to attack a tubercular bacilli. They carry the granules. Those are the weapons stored with them, like throwing the atom bomb, like that, you know. Yeah, they store granules. So the white blood cells we divide into granulocytes and the agranulocytes. Agranulocytes doesn't contain any granules. It forms an antibody. The granulocytes are storing the chemicals within them, which are used for destroying the bacteria and the viruses. Red blood cell, white blood cell and platelet. Platelet is required for, platelet was presumed to be only a function of clotting earlier days, but platelet is also carrying proteins within it, which are required for signaling, which is required for the growth factor. Wherever there is a tissue injury, whenever there is a bleed, the blood comes, the blood cells component sit on that, forms a plug, the clot plug stops the further bleeding. The cells which are sitting there, the blood cells, they provide a growth factor for the healing of the tissue. They provide a growth factor.
I see. And overall the function of the blood is to purify.
Purify. One is the red blood cell carries oxygen, supplying nutrients, that is oxygen to everywhere. To each cell require oxygen for metabolism. That is done by the red blood cell, and the white blood cell defends against the infection, and platelets against bleeding. And there are the proteins. Other than the cells, there is a protein. The plasma proteins we say. Those are required for the carrying. Other than oxygen, other than you need to carry vitamins which are absorbed from the GI system, which reaches the blood. It has to be carried to some other place. We need a platform for carrying. So the proteins which are traveling in the plasma, they bind the iron, they bind the vitamins. We call it as transferrin receptors. We call it transferrin, which carries the iron. We call it as cobalamin transporters, the methylcobalamin carrying proteins, like that. For each vitamins and this thing binds to each respective carrier protein, and it goes to different place. It delivers to the different cells. So from the GA, whatever you absorbed, it reaches the blood. There is a platform called the proteins which carry, and it goes to different cells of the body.
So it's well-defined system. Each cell has its own responsibility and duty to perform.
Blood is the only organ. It is an organ actually.
Oh, it's considered as an organ. Huh?
It is the only organ which goes everywhere.
Correct.
Round the clock, it goes everywhere. It is a circulating organ. The components of it are cells and the proteins.
And how much is the blood? That
5 liters.
5 liters.
A healthy adult man weighing 70 kilos, 60 to 70 kilos should contain 5 liters of the blood.
And what is that hemoglobin which we always say?
The red blood cell carries a molecule called as hemoglobin, which is required for binding the oxygen. Hemoglobin, hemo is iron containing protein, globin is a carrying protein which is sitting inside the RBC. Each heme molecule carries around 2 atoms of oxygen. They are inside that red blood cell, RBC, which we say. Inside that there is a heme. To carry that protein is a hemoglobin.
That is why when hemoglobin is less, you give iron.
Iron, yeah. We give iron, we give vitamins also to help the synthesis.
Correct. Now, if it has got such a complicated but well organized mechanism, see, you have different cells, each cell has a different function. There are platforms on which different proteins sit, things which we eat have to be transported. Now at each stage or in each of these, what should I say, cell level, anywhere, there can be problems. Huh?
Correct.
There can be problems.
Any change in the thing, like if the number of soldiers are reduced, there is a problem, like that. Like if the number of WBCs are reduced or increased, they may be there but they may not be functioning. The RBC numbers are been reduced, that is also a problem. So whatever the integrated design system, when any small change in that can create.
That is why the blood is I think it's the best indicator of any disease or problem that you have.
It's a mirror which can.
So first thing that any doctor asks is a blood test.
Blood test, yeah.
Blood test to be done in. They vary with the different diseases, of course. Now you have specialized yourself in hemato-oncology, which is cancer of the blood. Now, when you say cancer, everybody gets panicky, of course. Now, all other organs, they are only one organ. Now, this is a fluid organ.
It is circulating everywhere.
Circulating everywhere. So, where does exactly the cancer starts? Where? What is affected? Or everything is affected?
Everything goes back to the story of like, we have to go back to the history. Like that, everything goes back to the stem cell from where it is produced. The replicating cells within the bone marrow, once it starts dividing, it comes out. So it apart from circulating in the blood, there are some defending cells which are sitting in the lymph nodes. Those are the defense organs to fight against the bacteria and viruses. The cells which have come out, some of them will be sitting within the lymph node. So these are the circulating soldiers. These are the sitting soldiers, like lymph nodes are. So these are cells are they come from one primitive source called a stem cell. Whenever there is a change in the stem cell, a mutation, any change in the growth signal, they go for an toss, like uncontrolled growth. That converts them into a cancer.
Oh. But what is the cause of the mutation?
Cause of the mutation, some people can acquire like that only sporadics, and some people from, like there are many reasons, you know, the present lifestyle. Which
but is it genetic?
Yeah, there are inherited problems where we carry the mutations that can predispose us to cancers. Some are like sporadic, we say, without any family history they can have the problems. That is called as acquired mutations. Like they can happen like that only.
Just like
number of chemicals, pesticides, ionizing radiation. The general we discuss about the risk factor for the malignancies. Like same thing also applies here.
And any specific type of blood cancer related to specific age group?
Usually leukemias are seen in the blood cancer is a broad terminology which you can in simple we can divide into leukemia and lymphoma for a general discussion.
Correct.
Leukemia is something like a arising from it's a circulating like a blood like thing. The lymphoma mainly looks like a swollen lymph node. Basically they are connected, they are from the same tissue only. So it is in a circulating form, it is in a solid form like lymphoma. So leukemias are commonly seen in children and lymphomas are commonly seen in, there are different types of lymphomas, few are common in pediatric but more common in middle-aged and adults. Lymphomas are more common in middle-aged and adults. And there is a type of a blood malignancy, we can say slow growing or slow converting form called as a myelodysplastic syndrome, which is seen in the elderly people. It's a problem in a production. Instead of producing the normal healthy cells, the abnormal dysfunctional abnormal replicating cells will be produced and will thrown out to the blood called as myelodysplastic syndrome. That is typical in an elderly person. Rest other blood malignancies can come in pediatric and adults. As such, leukemias are common in pediatric group, lymphomas are common in adult and elderly.
What are the symptoms? So we'll speak pediatrics first. Because lymphoma, you can see it as a tumor. In children, what are the symptoms? It's very difficult.
Hematology deals both benign and malignant. The most common presentation which makes a person to think of underlying hematological problem is weakness, fatigue. See, hematology includes red blood cell, white blood cell, platelet. I'll come back to that only, the basic thing. So the problem, when the problem happens with the red blood cell, the hemoglobin decreases, the oxygen carrying capacity decreases, the person feels weak and sick. They feel hair hunger like thing, dyspnea and exertion when there is a problem with the HB, that is hemoglobin, red blood cells. When there is a problem with the WBC, they get recurrent infections. When there is a problem with the platelet count is low, they come with a bleeding. So the most common symptoms fitting into hematological problems is weakness, dyspnea and exhaustion we say, feeling like a sort of hair hunger like thing, and recurrent infection, bleeding, gum bleeding, red spots on the skin, fever which is not explained by the which is not fitting into our viral fever or whatever routine OPD checkup we do for the fever, the fever which is not explained by the routine investigation. Basic we can correlate to the basic like HB, WBC, platelet problem, which can make the patient to present.
So now see, suppose we take as fever,
yeah.
Suppose we take as breathlessness or weakness.
Yeah.
Common complaints of mothers at that age is the child is not eating.
Yeah.
So the child is naughty, so doesn't like to eat, it only wants to play. Fever, you go to this doctor, it is treated first as viral fever.
Correct.
Then you say do test for typhoid, and then another 3 weeks you have to wait. So you lose a precious time. Correct. So what is the time? I mean, is it okay if for a first fever you meet a hemato-oncologist?
One spike of fever, that one episode of fever, even I also say not required. So when the fever goes like a period of, we can't exactly say the period. So if the day one fever, we can just like think it as a viral fever, and second day something starts, the red spots starts, the gum bleeding starts, patient feels very much you can say very much exhausted like thing, The leukemia is something like it starts sudden, it is not like a slow growing phenomenon. Lymphoma can come as a slow growing phenomenon.
Leukemia is sudden, huh?
Leukemia is sudden, it's like a bomb blast,
Oh, I see.
It's like one cell divides suddenly into 1 lakh like thing, It's like sudden event like. So it causes sudden loss of cells, good cells. The sudden loss of HB, sudden loss of platelet, the sudden increase of the WBC is a typical feature of leukemia. So history will be very short here. There's 2 or 3 days of fever, but that patient feels that like he is feeling some sort of extremely exhaustion, sick, and he may get gum bleeding, he may get bleeding.
So you can make out that this is something different.
Sick, yeah.
You can make out.
What a simple message I want to give to the routine physicians who check for the fever, or the parents who go with the fever. They do test for the typhoid, malaria, dengue, I agree. Better to do complete blood count rather than just doing only platelet count. Or they spend resources on doing typhoid and malaria. I respect that has to be done, no doubt in that. For every fear we have to do that. Along with that, we need to do blood count, that is important. Blood count gives us a clue. We pick up on the CBC counts like unexplained sudden low hemoglobin, unexplained sudden low platelet count, on WBC something in series of 40,000, 50,000, 1 lakh, we need to think of a leukemia. At the other end is the lymphoma. Lymphoma is a very, there are high aggressive lymphomas which presents in 2 to 3 months, but if there are low to intermediate grade of lymphomas which goes a period of months, like 6 months, 4 months, they come with some weight loss, some loss of appetite, some evening fever like thing, over a period of 3 to 4 months. We call it as a B symptoms for lymphoma, which you heard of before. B symptoms means fever, night sweats, chills, and weight loss. That's a typical feature of lymphoma.
Now, say you have detected leukemia. How does the treatment start?
Most important is like we need to subtypify it, what type of leukemia it is.
It is a subtype.
Yeah, we have to risk stratify.
So
good risk, we say it is standard risk and high risk leukemias. For that we need further investigations to be done. We do molecular analysis, PCR analysis on the samples, on the leukemic cells, and bone marrow aspiration and biopsy to confirm the diagnosis, flow cytometry to confirm the diagnosis, immunophenotyping, flow cytometry we say. After that, for risk stratification we have to do genetic studies and PCR studies. Based on the risk stratification, we can counsel the family about the outcome, and then we need to proceed. Coming to the treatment part, once we risk stratify, we divide into called as a chemotherapy, and there's something called as stem cell transplant, which we need to discuss a little later. Chemotherapy, most of the good risk leukemias and the pediatric thing can be cured by the chemotherapy.
I see. They can be cured.
Yeah, aggressive lymphomas, like aggressive leukemias, we call it as there is a markers, genetic markers to say that it is an aggressive marker. Some we call it as in general terminology for the physicians knows as a Philadelphia chromosome, the 922 translocation. If that leukemia is seen, we need to take it as a little high risk one. We need to change our treatment plan. Along with the chemotherapy, we need to add some targeted therapies like imatinib, we say, along with the chemotherapy. And there's some, after the chemotherapy has been done, there's something called as a remission status assessment. We repeat the investigation which we done on the day 1 before the diagnosis. The molecular studies which we repeat to know the remission status. Here comes the, after the treatment, there is something called as MRD, minimal residual disease. If MRD is negative, we can just leave them with the chemotherapy. If MRD is positive, we need to think of changing the line of the treatment. Chemotherapy is a one type of treatment for the leukemia. Another one is the hematopoietic stem cell transplant. We say general terminology, we say bone marrow transplant. Everything comes from the bone marrow. Whenever there's a problem with the bone marrow, change the bone marrow. Simple like that. Yeah. But it's not like as easy, as simple as that. I explained. I know. There are indications we need to go through it by protocol and stepwise.
But this bone marrow is from the same person?
Two type of transplant. We call it as autologous transplant and allogenic transplant. Autologous, we take the we give the chemotherapy to the deceased person, eradicate the cancer cells, and once the cancer cells goes up, the newly healthy dividing cells comes up, we catch that stem cell. It's not a surgical procedure. Everything is simple collection. Simple.
I see.
Like a dialysis, we connect the machine and it collects the urea, abnormal product of the blood. Like that, we collect the stem cell from the machine. After the blood cells has been eradicated, the good cells comes up. We give a growth factor. We make the stem cell to exit from the bone marrow to the peripheral blood. Normally, the healthy stem cell doesn't circulate in the peripheral blood. If they circulate, it's very minuscule, which is difficult to catch. So we give growth factor to the, once the disease is controlled, when the disease is cleared up, we give a growth factor and make the stem cell to come out from the bone marrow to the peripheral blood.
This facility is available here?
I have come up with that task only to start up. We should be.
So we are going to have it in Goa?
Coming up with
Great. And what about blood transfusions? Because normally it is said that if a child had a leukemia and we get...
let me finish up this part. Sure. One is autologous, where we collect the stem cell from the same person. Another one is allogenic, we say, where we collect the stem cell from the sibling, from the brother or sister. We need to match them. There is something called as HLA testing. We need genetic matching, we have to be done, and then we have to collect the stem cell from the healthy donor. Simple, we give growth factor, collect the stem cell from him. We need to collect some volume, and we have to give to the patient after the chemotherapy and the disease has been cleaned. It's like the transplant, bone marrow transplant can be compared to simple farming in layman terms. First, we have to remove the weeds. That is, we have to eradicate the cancer cells, and we have to change the soil. They do some fluffing and they reverse the soil. And after the chemotherapy eradicating the cells, we give something called as conditioning chemotherapy to clean the bone marrow. We have to make the cells receptive, the seeds which we sow has to be receptive. So we we do the conditioning chemotherapy on the bone marrow, where all the cells become zero literally. We support him for 1 month with the blood products. And then we have to sow the seeds, that is a stem cell collected from and kept, and we give that, we sow that seed and we put water, fertilizers like that. We give a growth factor and antibiotics to prevent the infection. You have to protect the harvest from the birds, so we give antibiotic to protect the infection. This goes a period of 21 days.
I see.
So then the new seeds which has been sown, they go to bone marrow, they sit the place, they identify their location, they sit and they divide, and they again they respread the healthy cells everywhere.
So I mean, as per the gradation, if the cancer is not very aggressive, then it is curable.
Curable, yeah.
It is curable.
Yeah.
That is great news. That is great news.
The low grade leukemias, we say that like pediatric leukemia, we are seeing around 70 to 80%. They do good. They live like other people. The pediatric, especially the good risk, where all the risk markers have come negative, they do good. We give a chance of 70% of curing them. 70 to 80% chance of curing them.
No, I was coming. We'll hear a lot about blood transfusion. The child had cancer of the blood, and then we had to give a lot of blood transfusion. When does that come into picture?
See, coming back to discussion of blood transfusion, the guidelines are now streamlined very much. The indications of the transfusion, we need to be very specific to give the blood. In an emergent condition like a leukemia is like sudden, like the bone marrow has gone for the shutdown, there is no any production of the blood cells in the body, the HB something drops to something like 4 or 5. At that time, it's wise to transfuse and keep the hemoglobin well above like 7 to 8 gram to maintain the normal functioning of the body. That is the emergent indication for the transfusion. And the massive trauma, road traffic accident, the bleed, that is one indication of the transfusion. The routine thing like nutritional deficiency, like iron deficiency anemia, B12 deficiency, the transfusion is a very last resort to be done. First is oral iron therapy for iron deficiency anemia, or like if the person is not in a position to take oral or incompliant or compliance is a problem, then intravenous iron therapy, intravenous B12 to be given. In a B12 deficiency, the hemoglobin can come as low as 3 to 4. If we need to do the we need someone has to see the peripheral smear, and we have to do vitamin B12 studies if we are sure about a B12 diagnosis. Just an injection of a methylcobalamin with just 40 rupees to 50 rupees, the 3 doses of injection can change the picture. The hemoglobin 3 to 4 gram can become 8 to 9 gram in a period of a week. So transfusion in that we don't do. B12 deficiency and iron deficiency, we keep it as a last resort. In another way I can say as we avoid transfusion.
The last question. Can blood cancer happen in elderly people?
That's what we discussed. There is an entity called as a myelodysplastic syndrome. As the cells divide, each cell has a coding for a number of times it to be divided. Okay. There is something called as a telomere and a chromosome, which you heard of, the end of the chromosome. So once the cell sense that like I have done my duty this many times, I divided, then it goes for attrition. We say something like that. Attrition. It changes its some sort of its phase. It changes. Either it suddenly go for shutdown, or it goes for some mutation and goes for a toss, and it divides too much. That's regarded as myelodysplastic syndrome. There are 2 variants. One is hypo variant, like hypoplastic myelodysplastic, where the marrow goes for sudden shutdown. Some signal comes and cell stops dividing. Myelodysplastic syndrome is the malignancy in the elderly people which we see.
Elderly people, पळोवपाक तांबडे रक्त तें एक थेंब केन्नाय भायर सरता तातूंतल्यान, पूण रक्त म्हळ्यार दोतोर महादेव स्वामीन सांगलें तशें इट्स एन एडमिनिस्ट्रेटीव प्रोटोकॉलान सगळें बशिल्लें. सेल्स खंयच्यो, तांणी काम कितलें करप, काम जातकीच स्प्लिनान वचप, थंय डिस्ट्रॉय जावप, तातूंत भितर जाल्यार कोणें मदीं फायल दामून दवरली जाल्यार कशें आमचो गोंदळ जाता ऑफिसांनी वतकीच, तसो एक सेल जाल्यार तातूंत बोवाळ करत जाल्यार सगळो गोंदळ जाता. आनी म्हणून ल्हान भुरग्यांक जोर आयलो जाल्यार चड वेळ ताणचें न्ही. तातूंत पयलीं ब्लड टेस्ट थोडी आतां कितें जालां तितल्याच पुरती करप ना. कोणें तरी सांगलें डेंग्यूसो दिसता म्हणून प्लेटलेट कावंट केलो. कोणें तरी सांगलें आपल्या भुरग्याक कशें जाल्लें, ताजें हिमोग्लोबीन कमी जाल्लें म्हणून फक्त हिमोग्लोबीन केलें. अशें करिनासतना दोतोराक सांगून ताजो सगळो ब्लड कावंट करपाचो, हिमोग्राम म्हणटात ताका, तो सगळो करून घेवपाचो आनी तें दुसऱ्या कोणाक तरी दाखोवपाचें. डॉक्टर महादेव स्वामी आतां मणिपाल हॉस्पिटलान आसतलो, ताजे कडेन गेले आतां. अशें कोणाक तरी दाखोवन मागीर ताजेर उपाय सुरू करूं येता. आनी दोतोरान आमकां एक बरी गजाल सांगल्या की भुरग्याक जो ब्लडाचो कॅन्सर समज जालो आनी तो जाल्यार बेगीन कळ्ळो जाल्यार इट इज क्युरेबल. तो भुरगो सारको जाता आनी सगळ्या सारकें नॉर्मल आयुश्य जगता. हे दोतोर आमचे कडेन गोंयांत आज मणिपाल हॉस्पिटलान आयल्यात. म्हाका दिसता आमी सगळ्यांनी ते हांगा आसात आनी नवे नवे कितें तरी हांगा घेवन गोंयच्या सगळ्या लोकांची भलायकी सारकी दवरपाचो प्रयत्न करतात. तांचो आमी फायदो करून घेवया. थँक यू व्हेरी मच फॉर वॉट शूड आय से, सो exposing what the blood is. I mean, it's great. Nobody knows about this. We see only red thing there.
Blood is red, but it contains many other things
I
in that.
know.
Red is the RBC which carries the color, but there are many parts. The simple message what I can give to the family and the physicians is like when they do blood test, the hemogram has to be done. Once it is out of the range, like you feel that like it's not fitting into viral fever, there's something else, better like. Always my department is
of course.
referred one only, and it's better to come through physicians.
Thank you so much. Thank you so much.